Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and we're sitting down with two of our sports medicine and urgent care experts to discuss what annual sports physicals are and how they can prevent young athletes from injury. As we approach the new school year, many student athletes will be returning to organized sports. Since most schools require annual sports physicals for students to participate, it's important to know what that entails. So, to find out more, let's meet our experts. First, we're going to start with Dr. Kelly Ryan. She specializes in treating concussions, orthopedic injuries, injury prevention, nutrition, and training needs of athletes. Dr. Ryan is board certified in family medicine and received her fellowship in primary care sports medicine with additional certification in caring for athletic populations. She treats family medicine, sports medicine, and non-surgical orthopedic patients at the MedStar Franklin Square Family Health Center, MedStar Franklin Square Orthopedic Institute, and at MedStar Health Urgent Care. Next, we have Certified Emergency Medicine Physician Assistant Amanda Joy from MedStar Health Urgent Care, where she is the Associate Medical Director. Amanda performs sports physicals at MedStar Health Urgent Care centers and provides immediate evaluation and medical care for all types of illnesses and injuries, including sports-related ones. Welcome, Dr. Ryan and Amanda. Thank you for spending time with us today.
Good
Hi, how
afternoon.
are
Thank
you?
you.
All right, I have lots of questions for you, so let's get into them. Dr. Ryan, I'm going to start with you. Let's start with the basics. What is a sports physical? What does it cover, and what's included?
So, a sports physical is a physical exam that we do that's specifically tailored to making sure athletes are safe when they're out there on the field. One of the main things that we look for and try to prevent is sudden cardiac death. So, trying to get any type of symptoms that might show that the kids might be having some symptoms that they didn't bring up to their parents, making sure that there's no significant family history that we should be concerned about. So that's the cardiac side, but also we're just making sure that there's no orthopedic injuries that they haven't gotten taken care of, making sure that we counsel them appropriately on concussions and seeing whether or not they've ever had them before, trying to figure out whether or not they've ever been held from sport for any particular reason. And a lot of people don't want to necessarily always be forthcoming with us about their sports physicals. But what I always try to talk to my patients about is I'm not trying to keep you out of sports. I'm just trying to make sure that when you play any type of sport that you're healthy and that we don't have to attend to um, any emergency situations while we're out there on the field with them.
Thank you very much for that. And yeah, you talked about why it's important to get a sports physical, but why is it often required for high school and college athletes?
Again, same reason, because there are specific things that we look for, particular medical conditions that put you at risk for, again, sudden cardiac death or you know s- a life changing injuries that we try to prevent. And then also just so a lot of schools have athletic trainers, not all of them, although all of them should have athletic trainers. But it also helps them to kind of get information on all of the athletes and prepare them, for any type of special conditions that they might have to worry about. And so that's one of the reasons that it is required in order to play sport for an organized team.
All right, thank you so much. Amanda, what about age? At what age is it good to start getting sports physicals, even if your child's sports team doesn't require one?
So a good common practice is to start in middle school. Most programs from middle school forward for organized sports specifically suggest that you get a clearance or evaluation to play. If your child has known medical issues that may impact play, something neurologic or cardiac, pulmonary like asthma, or they have a single organ, they were born with one kidney, for example, that is a good time to have a provider evaluation and make sure they can be cleared to play. Regardless of the child's age, you should always mention the sports that the child plays at their pediatric well visit so that their provider knows what they're playing and can discuss with you any additional risks.
Good point. Thank you. And is a sports physical done in urgent care by a provider who may not necessarily know your child's history? Is that really as good or as comprehensive as one performed by their child's pediatrician?
I would like to think that they always are, but that's not always the case. We're fortunate within MedStar to have access to medical records. So if you're a MedStar patient, we can look through. But oftentimes you have grandma or somebody who isn't in tune to a child's history, bringing them in for their physical. And so they may not appropriately answer those questions. So having that knowledge is great. But yes, we are able to do an adequate and comprehensive exam, but it really is dependent on having that knowledge and making sure the history is there for us to review.
Thank you so much. So yeah, benefit of going to MedStar Health Urgent Care is that you have access that provider while they're not necessarily their pediatrician, they would have access to their pediatric notes if they're a MedStar pediatrician. So we would have access to that. And it's also important to talk through the history as we talked about before and talk about what sports they are participating in, giving that provider as much information as possible before the exam.
Absolutely.
I'll also add, just to make sure that when you do go to these sports physicals, that you have that information filled out by the most appropriate person. So if grandma or grandpa is taking your child to their visit, making sure that you're the one that's filling out their medical history and that it's filled out ahead of time and they're not just filling it out in the waiting room. But certainly I've had some old fractures that the kids forgot that they ever even had. Or some other situations that people forget about. So yes, it's nice to keep it in the system.
Yeah. Thank you for that. So yeah, thank you both for the great start to this conversation. I'm going to pause for a moment just to welcome our viewers again. Thank you for joining. We're here today to discuss what annual sports physicals are and how they can prevent young athletes from injury. I'm joined by two of our sports medicine and urgent care experts, Dr. Kelly Ryan and physician assistant Amanda Joy. We have more to talk about, so keep watching. Share this broadcast with your friends and family. And if you have any questions for our experts, please share them in the comments. So let's talk now about recreational sports. Dr. Ryan, this question's for you. Does a child need a sports physical and if they are not in an organized sport and just do recreational activities like skateboarding, tennis, or bike riding?
So do they need one? If there's not an organization looking out for them, then no. But they all should, if they're physically active and they're involved in any type of sport. I think it's important information just to bring up to your pediatrician, or to have these things evaluated. Because I mean, look at the Olympics now, right? We had breakdancing and things like that. So you know it it's not so much a logistics thing as needing it, but really more just making sure that you're having these conversations, whether it be during the well child check. But it's not typically required unless some organizations are. Some tennis programs, are requiring these types of things. And I recommend, that if you do have an organized sport, the governing body probably should be recommending it. They're
Mhm.
important.
And they can talk to you about safety equipment like helmets and knee pads and elbow pads and those sort of things as well.
And helmets, yeah, helmets.
Helmets.
Definitely. I was just riding my bike with my daughter last night, and we both had our helmets on, and we talked about the importance of having our helmets. So yeah, there's other safety tips and direction you can get from having that conversation with a provider to make sure you're being as safe as possible, even when you're not doing an organized activity like playing organized soccer, et cetera.
Absolutely.
Dr. Ryan, how often do children need a sports physical?
So we recommend once a year. Things can change, symptoms can come up, and again, one of the hardest things is shortness of breath, or do you ever get chest tightness? And that should be evaluated and reviewed every single year. And sometimes the kids just think like, oh, well, it's just typical exercise. But really kind of teasing out those symptoms. And sometimes they'll kind of downplay some of their symptoms like, oh, I almost passed out, but I was just dehydrated. We never want to just settle for that answer. And so it's really important to talk about these things yearly at least. To kind of really dive deeper and make sure that we're not missing something. Or, a kid might have newly diagnosed asthma that wasn't a problem before, and, you know, now having worse allergies and having those symptoms. So it's always important to do these yearly. Actually, in college, we do entrance and exit physicals. So sometimes they'll even get it more than once a year. When they finish up their season, we'll actually do an exit physical just to make sure that we reviewed any types of injuries that they had and that everything had been reported.
Okay, good to know.
But that's not required. That's not required for the general public.
Okay, good to know. What about if your child sees their pediatrician for an annual wellness visit? Should they still do, or they were considering getting an annual exam from their pediatrician? If they had that planned, but they got a sports physical, should they still get their annual exam with their pediatrician? What do you recommend?
Absolutely. Absolutely. So I do sports medicine, but I also still do general family medicine and pediatrics. And they are not the same. And it depends. When I do my well child checks, I will talk to them. And if they are active in sports, I'll make sure to go over the necessary information for the sports physical. But the well child check is really also is really important. One, because we check for vaccinations and make sure that they're up to date on that. Also, mental health is like a really big piece of our well child checks these days, and it's not necessarily it's actually updated on the newest sports physicals. There are some questions on it in the most updated version, but it's not necessarily always touched on quite as much. And we can talk about bullying and social media stuff, during our well child checks. So they can be done together, but typically, it just depends on when you get your well child check and whether or not the necessary information is completed at that time. So again, one is not the same. And so I do recommend that you at least be addressing both. But that's not to say that they can't be done at the same time.
Well, and most of the sports physical forms do require the examination be done after June 1st of each year. So if you've had it done in February, then you often can't just send your paperwork in because the exam wasn't recent enough.
Hmm, that makes sense.
Yeah, a couple of, things might have happened in between. And again, if that particular doctor that was doing the well child check wasn't in tune, they might not ask as detailed of questions, and they might not do as detailed of an orthopedic exam.
Hmm. Okay, thank you so much. Amanda, in terms of preparation for these visits, what should parents, caregivers plan for ahead of time before they get their sports physical? Is there any specific paperwork that's needed? Can you talk about that?
Sure. I know Kelly touched on this a little bit, but there is a universal form that's been approved by the American Academy of Pediatrics, the sports medicine folks, the family practice folks. So it's a wonderful universal form. You can download that if you've lost it, can't find it on the internet. It comes in both English and Spanish. There is a section that's to be filled out by the parent or the athlete and the athlete, and then a section that has to be filled out by the provider. So I think it's important to take time and accurately fill out the answers to those questions before you get to the office. Trying to do that in the waiting room and rushing through, you may forget some things that have happened over the last year or something in your history. that could be critical in preventing, a life-threatening condition or injury. There are also some programs, my child plays football, and you have to have a specific football form signed for them in the rec. So having a specific form, if it's not the universal form, you definitely need to bring that along because we don't have access to something like that.
All right, thank you so much. And I appreciate the reminder to fill out the forms before you get to the office, because I'm guilty of that, where I don't always do that. And then I'm scrambling because you're with your child, I'm usually sweating and I'm juggling a bunch of things, and I will fill that out a lot quicker because I'm trying to get it done, to get it turned in before I get called, or the provider comes in to talk to you. You can be distracted. So I really do. I'm listening to that that advice myself, and reminding myself to fill out that paperwork ahead of time, because you have that focused time where you can make sure you don't miss anything.
Well, and that mental health screen. Mom should not fill that out for you, right? We should have the
Yeah.
athlete answer those questions and not have mom say, no, they're not depressed. And, they're not having any sadness or, feeling down. That really needs to be answered by the athlete, not the parent.
Yep. Makes sense. All right. Thank you so much. Another question for you. We talked about vaccinations in the context of your annual kind of pediatric exams, but in terms of playing sports, do children need specific vaccinations before playing sports? Question for you, Amanda.
Yes, they just really need their standard vaccines. Those are always recommended. Close contact sports, you can easily spread infections. So it's not mandatory. So if you were to have a vaccine exemption through school, then it may not be required for you to have vaccines to play a specific sport. But if there is an outbreak that happens, you may be restricted from being able to play in the championship game, for example, because there's a measles outbreak, which can be very upsetting for both parents and children. But it's really meant for not only the safety of the athlete, but the safety of everyone that's there within that facility, even spectators.
Yeah, makes sense. Thank you so much. So my child's vaccinated. They've gone through their sports physical. They've even seen their pediatrician recently. They are ready to go, cleared, ready to play sports. There's always that risk of injury. Amanda, can you talk about some ways that, even with all of the pre-work, how can children prevent injuries when it comes to playing sports?
Well, I would start with hydration. Often kids are terrible at drinking, making sure they have plenty of water. They have, electrolyte containing fluids like Gatorade or Pedialyte, or even liquid IV that they can have to replenish those electrolytes. With the heat of the summer, heat-related injuries is also a big concern. So making sure that they're well hydrated, they're resting. And then with any physical activity, don't just go out there and do it. You want to make sure you stretch and you warm up and get your muscles ready to participate in the sports. And then specifically related to the sport that they're playing, make sure you talk to the coach, the athletic trainer, to see what's recommended safety equipment. This year, my son is playing football, and we had the ability to get Guardian caps for them to help prevent concussions or improve the injuries related to head injuries in football. My daughter is playing volleyball, and so they recommended knee pads and elbow pads. As a parent, don't think that these are just accessories that your kid has to have, because I know kids want the latest and greatest, but certain safety equipment really should be purchased and used to make sure they're preventing injury. So it really depends on the sport itself, but
Mhm.
the coach and the athletic trainer should have a lot of specific information regarding that.
Thank you so much. And I'm glad you mentioned heat related injuries because, yeah, I don't always necessarily, I definitely wasn't thinking about that. I'm sure our viewers weren't necessarily thinking about the heat. So starting with hydration was great. And thanks for sharing all the wonderful tips to help prevent injuries. Dr. Ryan, if my child is injured while playing sports, what are the first steps someone should take? Or even if it's a recreational activity, what should they do?
So I'm going to go back to your previous question first, if that's okay.
Yeah, go for it.
So in terms of like talking about how can we prevent injuries in our children, I think knowing the coaches, watching the practices, is really, really important because there are different types of techniques that have been, evaluated and especially in concussion and football, there are different ways of tackling, making sure that they're tackling properly and that that's being, that those techniques are being taught properly is really important. And duration of the workouts, how hard are they being pushed, those types of things, how many reps are they doing, and just kind of getting a good feel of whether or not you feel that this is a good team for your child and how are they feeling after they're doing their workouts, because we definitely want to monitor the safety of the children. One of the other problems with this particular start right now is everyone is so excited to get back to sports, but they haven't been working out all summer, or they, haven't been really working out as much as they should have. And so they're raring to go. And then they kind of get some overuse injuries from just revving up too fast too soon. So gradual increase into your sport is really important. And then making sure that you're preparing for your sport is also important, a couple weeks before your sport actually starts. So you don't just start as soon as tryouts are there. So that's definitely one good, two different ways, making sure that you're prepared, and then making sure that you know your coach, and team dynamics and things are really important. Now, if you do have an injury, we are fortunate in some of our schools to have athletic trainers. Our athletic trainers are wonderful medical professionals that are present at a lot of our schools, but really help to prevent injuries, are there for when injuries happen. They also have the ability to do some physical therapy types of techniques and working with the children if they do have an injury. And they're an excellent, excellent resource. So if they do have an injury, sometimes just stopping by and talking to them first is helpful. Or they might even be out there on the field and can help to talk to parents about what they should do next, whether or not they need to go to an urgent care center and have it evaluated right away, or whether or not they could kind of watch and wait. One of the big things that we look for in terms of children who have injuries, like, are they limping? That is super important. If you have a limping child, then they need to be seen, and they should not be playing. They should not be practicing until they're evaluated. Because if you have a limping child, then they're not really um, working out the way that they're supposed to. And if that's not even an injury, then they could put themselves at risk for another injury. So really getting kids evaluated like that. If your kids are asking and need some type of medication, I think that that's also a good kind of sign. Hey, maybe we should take them in to see the doctor, right? Because kids probably shouldn't need pain medicine. So if they're asking you, then that's something. Swelling, look for swelling. That can be really telling for a specific type of injury. But regardless, you can, of course, we have our urgent care centers, which are really wonderful because with the time that they're open, if it happens during sports, and sometimes it's difficult to get into your primary care office. Sometimes it might take a couple days to get into to an orthopedic office. But if they go to urgent care, they can get their initial evaluation. They can get a referral to a sports medicine doctor in the area, or orthopedic, or whatever they need, and can also get an X-ray if it's necessary.
Thank you for that. That's a great point. How could our patients find the nearest MedStar Health Urgent Care? And you mentioned the hours. When are they open?
Amanda, do you want to take this one?
Sure. Our urgent cares are open 8 to 8. We have 33 urgent cares across Maryland, DC, and Virginia, so lots of access to care. Our online landing page is the best way to find one of our sites, and you can actually save your spot in line so that you can limit your wait time coming in. The other wonderful thing that we've done is, as a parent, you'll find that many urgent cares right now don't have radiology technicians. There's a nationwide shortage. So MedStar, typically we have X-ray capabilities in all of our sites. But if we don't that day for some reason, we will put that on our landing page so you could go to a neighboring site instead. You'll know ahead of time, do we have X-ray available if you're worried that your child has an injury that would require imaging.
And the nice thing is that when they follow up with us in the MedStar system, because I work at urgent care, but I also am a sports medicine doctor in MedStar. So, I definitely, it's nice to have the images from our urgent care centers available to us when they come in for follow up. So that way we don't have to re radiate the children if, we don't like to do that. Sometimes if they come from other urgent care centers, we might not have access to the images, but it's nice because in MedStar, we have access to that for close follow ups.
Absolutely.
Thank you for adding that. Thanks, Amanda. Another question for you. What types of injuries can MedStar Health Urgent Care treat?
We can do lacerations, we can do suturing, skin glue, fractures, minor dislocations. So if you think you may have dislocated a finger or a toe, that's urgent care. If you think you've dislocated a shoulder, an elbow, a hip, a knee, that may be more signs to go to the ER. We can do basic, musculoskeletal injuries like sprains and strains. We can also provide the initial assessment of head injuries and assess for concussions, and then refer to our wonderful sports medicine team or our Head First concussion program for close follow-up.
Thank you. And what if a patient comes into MedStar Health Urgent Care and they feel their injury is appropriate for urgent care, but it's more challenging than some of the things that you mentioned? What happens then?
That's a great question. That happens all the time. We get folks who come in, we can always provide that initial assessment. We can get an X-ray if it's beyond our capabilities. We have a couple options specifically to MedStar Health Urgent Care. We could send you to one of our MedStar ERs where we can alert them ahead of time what you're coming in with. And we also have virtual consults with specialists available right in-house in MedStar Urgent Care. So if there was a question about an orthopedic injury, do they need to go to the ER today, or can I have them see orthopedics in the next day or two? We can actually consult virtually. The orthopedic specialist can look at those images, give us recommendations on how to stabilize the injury, and then set them up for expedited follow-up.
Mhm. All right. Thank you very much. We talked about the emergency department, and you mentioned you could see a specialist who tells you to go to the emergency department. You also mentioned in terms of the types of injuries that MedStar Health Urgent Care treats, there's times where you might need to go to the emergency department instead of using urgent care. What's your advice on how someone would know I should go to the ER versus urgent care?
So
Dr.
one
Ryan?
of the biggest things is if there's a deformity. If your limb does not look normal, please, by all means, do not come to see us at urgent care. Please go to the ER. If there is like uncontrollable bleeding that seems, more significant than a small cut or something like that, please go to the ER. Any loss of consciousness, even if it's very brief, particularly in children, if there is any sign of loss of consciousness, and then especially if there's vomiting, then that's the sign like that a head injury is probably more serious than just our typical concussions, and probably should at least be observed for some time to make sure that there's nothing worse going on, because concussions are bad, but bleeding into the skull, or something like that, that could be life threatening is much worse. And so at least if they go to the ER, they can be monitored for a little while, as in the urgent care, we don't necessarily really monitor the same. So, and then they, depending on what their head injury was and how long they were unconscious for, the doctor might decide to do a CT scan, and it's not necessarily always required. It really depends on the case, but those would all be reasons. You had mentioned before dislocations, except toes and fingers, are mostly able to be managed. The other thing is, if your kid is just uncontrollable, like just uncontrollable pain, then going to the emergency department might be helpful, because they can at least make them more comfortable.
I would also mention if the injury was to their trunk, so they were hit in the abdomen, the chest, if they're having severe pain associated with that, could we assess them? Absolutely, but sometimes time is important. They could have an injury to the spleen and have internal bleeding. Those may be signs where you want to just go on over to the ER, where they have more advanced imaging techniques and laboratory studies that they can get urgently, that we can't get at urgent care.
Yeah, absolutely. And unusual, like shortness of breath, please go straight to the ER. There can be a couple like neck injuries. I've had someone who took a hand to the trachea and had difficulty breathing. Please take them to the emergency department.
Yeah.
Thank you so much for that. So we talked about when to come to urgent care, when to go to emergency care. We talked a little bit about the telehealth options that are available when you go into urgent care, but what about MedStar eVisit telehealth, our 24/7 access to on-demand care? Dr. Ryan, can you use MedStar eVisit telehealth for sports injuries?
I think that telehealth can be used mostly to like triage the situation. Maybe if you needed some advice about where to go. But ultimately, in these types of sports injuries, it's really a benefit to be able to be evaluated in person, or at least have the option. And also, in case imaging is necessary, because what we do is we're able to like touch the area to really kind of feel what the anatomy is, and to make them like kind of move around a little bit better. And there's some different tests that we do specifically for musculoskeletal injuries that we can. It makes it really difficult on. It makes it really difficult on the telephone, or like over a computer. And when I tell you that during COVID time when we had to, it's really hard for them to get the camera on their like particular body part that I'm trying to look at, and it's just very cumbersome. So maybe there's a place just to help with guidance. What's next step? But ultimately, really, urgent care is going to be a better option for you.
100% agree.
Thank you very much for that. That makes a lot of sense, especially if you don't know where to go. That's a good place to start.
Absolutely.
Question for both of you. What other resources does MedStar Health offer for injury prevention and recovery in student athletes?
So in sports and in MedStar in general, right? So we have our urgent care centers, but we also have a multidisciplinary sports medicine team. I work with them very closely, and they are excellent. We have physical therapists, we have athletic trainers, we have sports trained primary care doctors. We also have sports trained orthopedic doctors. Our orthopedic surgeons, and our primary care doctors in the MedStar system also take care of a lot of the professional teams around the area: Ravens, Orioles, a lot of schools, a lot of colleges. And so they have a lot of experience in that. One of the big things that we do try to advocate for is making sure that we have a good amount of athletic trainers who are involved. And they do a great job. They actually have a community liaison program where they try to do outreach programs and those types of things, and helping to prevent injuries as well. So you can actually look on the website, and they have some dynamic stretches that you can do. They give good information on nutrition and hydration. They do things like this. So there's a lot of education that comes from that group. And one of the other things that we're really advocating for is making sure that athletic trainers are available at your child's school. Not every single school has an athletic trainer. We have a group of athletic trainers that work through MedStar Health. But then there's also each school has their own athletic trainer, which may or may not be associated with MedStar. But making sure that you know who your child's athletic trainer is. Do they have one? And if they don't have one, you should definitely advocate for one, because you want someone to be there when your child has you want someone to be there in case your child has a really serious condition.
Kelly, don't we also have the Orioles pitching lab that you can go to
Oh
where
yes,
you can learn mechanics of pitching and they can assess your throw and those sort of things?
yes, absolutely. And within our sports medicine group, we also have a golf lab that that they will evaluate swings and things like that. I got to tell you, they're doing a lot of really innovative type of stuff, and they can work with teams. So if you have a team, you can reach out to us, and some of our physical therapists who specialize in our pitchers, they'll actually come out and do like a clinic, or bring the team actually to the pitching lab and really go over techniques and those types of things. For our runners, we have some clinics that our physical therapists and our doctors who really specialize in running medicine. They actually go out into the community and will watch you run and check out your shoes. Sometimes they do that at some of the Charm City Run events. They just had a really great event up in Cockeysville at the new training facility there, teaching women how to work on, improving their strength and making sure that they're doing it properly. So, you know, we have a bunch of different types of sports specialists. Me personally, I specialize in equestrian medicine and taking care of jockeys, and people who ride horses. So I might be able to give them more tips specifically on that type of thing and talking about proper helmet use and proper helmet wear. And so we have a ton of different specialists in the system that have particular interests. We have a golf group, we have a baseball group. So, there's really a lot of there's a lot of resources out there, and I love our multidisciplinary group for that, because also when I'm seeing a patient, I can contact my physical therapist, and see, what do they think. They also are trained in physical therapy for concussions, which a lot of people didn't even know existed. We have occupational therapists, speech language pathologists, all sorts of great experts.
Wow, it sounds like we have a ton of great resources for our athletes. Amanda, anything to add to that? You added the pitching lab.
I would just say that I am the parent also of a soon-to-be high school athlete, and she fortunately sees Dr. Ryan. Um, Things I thought were just normal growing pains, and kind of were like, you're fine, shake it off. I quickly learned that maybe they weren't just growing pains, and Kelly was wonderful, fully assessed her and recommended some PT to help strengthen ligaments. Kids grow quickly these days and they're having these growth spurts, and sometimes there's extra stress on those ligaments. And with a little PT and good mechanics, you can really prevent injury for these kids. So the answer shouldn't be you're fine, get back out on the field. It should be like, okay, let's get you assessed and see what they recommend.
So also with that, that's a great point, Amanda. And yes, I love seeing her daughter. Yeah, it's really nice to see our young high school athletes that are just excited about sports and still really love the game. And it's nice. Sometimes we'll like talk shop with them, and I think that that's one of the things that really gains our our trust. Well, that the children have trust in us, because I know what kind of sport they play and I understand the demands. But one of the things that happens is we have athletes that are playing year-round soccer, year-round lacrosse. Um, Actually, early specialization in sport, we try to prevent that until they're a little bit older. And then also, you have to make sure that at some point they get a break, because these seasons are just going back to back to back. There's indoor, they have all these different tournaments on the beach now. You really have to take a look and see how much are your kids exercising, what is their type of schedule, and whether or not you're actually giving them a chance to be kids. And growing can really be difficult on them. And it is, sometimes they grow overnight, it seems like. And when their bones grow so fast, their muscles and their tendons don't necessarily grow it. They can't stretch as much. And so, there's a lot of flexibility issues. And sometimes they're like baby giraffes. They're tripping over themselves all the time. So, making sure that you give them a time to just be kids, and not be in this competitive nature, can be really important.
Mentally as well.
Yes, yes, yes. Sometimes we see performance changing and we have to take a step back and say, like, is this kid really like enjoying what they're doing, or is there too much pressure on them? Because there is a lot of pressure. I mean, gosh, all the social media and the teams and trying to get into college when they're like in middle school. So yeah, give them a chance to be a kid.
Absolutely.
Love that advice. Thank you so much. That is the last question that I had, but before we close our broadcast today, you both have been sharing some wonderful takeaways, some great tips. Anything else you want to make sure that our viewers get away from the discussion today? Dr. Ryan, I'll start with you.
Well, actually, I'm going to pass this buck over to
Okay.
Amanda, because she has done some wonderful things in her community, around AEDs, which is really important. We actually also have sports medicine trained cardiologists in the MedStar system. But a lot of the sports physicals that we do is trying to prevent sudden cardiac death and trying to pick up risk factors for this. But when it actually happens, you want to make sure that there's an AED around on the field, that people know how to do CPR. Really, honestly, there's a hands only CPR. Sometimes CPR can be really can be really overwhelming, and can, people feel like they have to do this breathing thing as well, which is not necessarily true. Even just, hands only CPR is really important. Kids actually should be taught. I think that they're able to, and who knows if they're going to be the ones that might save their teammate one day. Making sure that you have a good emergency action plan, making sure that your school knows where is the AED. If you had to call an AMBO, where will they show up, and helping to direct them, is something really important as well. But I'll let Amanda talk more about AEDs.
I think it's a very important topic. A lot of the rec programs are played at schools that have AEDs, but they're locked inside the building and they can't be accessed. So I think it's always important. And my son plays football, and when we go to away games, I always ask, where's the closest AED, so we know. We've seen all these athletes, Jamar Hamlin, Bronny James, these sudden cardiac arrests that were completely unanticipated. So we have to be prepared for that. So teaching your coaches CPR, your parents CPR, and I agree, the kids, we started doing drills in our rec where we take a mannequin out and put it out, and then have the kids help us navigate what to do. And it helps them psychologically process emergency situations a little better. Not that it's not going to be traumatizing to them, but it will help them know the pieces and parts. What are they doing? Why are they cutting off this clothing? Why are they pushing on their chest? Why is that machine making their body jump? Those sort of things, they'll be able to understand and process. So I think it's critical. Kelly's soapbox is have an athletic trainer, which I 1,000% agree with. And mine is make sure your coaches, parents, and kids are trained in CPR and have access to an AED.
Thank you both so much. I will definitely take that away, and I hope our viewers do as well. We shared a lot of wonderful information. Thank you both for the time today. I learned a lot. I hope our viewers did as well. And what I would like to say before we close our broadcast is that we have, as we mentioned, MedStar Health Urgent Care across the entire region. To learn more about the types of services that we offer, including sports physicals and immediate care for injuries, you can visit us on our website, medstarhealth.org/urgent care. We'll share that link in the comments as well, so you can check that out. I wanted to thank our experts, Dr. Kelly Ryan and physician assistant Amanda Joy. We really appreciate your time and your expertise. And thank you to our viewers for watching us today and sharing your thoughts and questions. We'll see you next time. Have a great rest of the day.
Bye. Thank you.